Healthcare costs are at an all-time high in the United States. According to the Centers for Medicare and Medicaid Services, national health expenditures grew 9.7% in 2020 to $4.1 trillion, or roughly $12,000 per person. But in reality, the distribution is far from equal. Researchers have found that just 5% of patients in the U.S. make up half of the country's healthcare spending. These 5% of so-called super users have complex medical needs that make them heavily reliant on the healthcare system. Community Servings, a nonprofit organization in Jamaica Plain, is looking to change that.
We're creating and scratch-making meals for people that are nutritionally appropriate for whatever the illness is that they have. So it could be that you need a low-carb, carbohydrate diet for somebody with diabetes. It could be that you need a diet that's high in protein for another type of illness. And so that's what we look at. We say, what type of illness do you have, and what is the diet that would help improve their condition so that they can have a better quality of life and improved health outcomes.
Medically tailored meals, or MTMs for short, are meal plans tailored to the medical needs of the recipient by a registered nutritionist and are designed to improve health outcomes, lower cost of care, and increase patient satisfaction. At Community Servings, they offer 15 different medical diets to over 2,000 clients, making and delivering 22,000 meals each week.
So Community Servings has so far conducted 4 studies, all proving the efficacy of what we do, that medically tailored meals, not only do they improve health outcomes, they actually lower healthcare costs.
Patients who received medically tailored meals were admitted to the hospital 50% less than those who did not receive MTMs. Researchers have found that improved health outcomes not only increase the quality of life for patients, but also resulted in a 16% net savings on healthcare cost after subtracting for the cost of the MTM program.
That's what we're trying to do with the research, is really prove that ROI so that the healthcare providers, the healthcare payers, if you will, take notice. And the good news is they are.
Community Servings and its partners across the country have operated off of charitable donations for years, but advocates say that for MTMs to become broadly accessible, they need to be integrated into the healthcare system. Massachusetts has led the way on this issue with its own MTM pilot program, providing Mass Health recipients access to the service since 2020. But advocates want to see that same legislation on a national level. That's exactly what H.R. 5370 hopes to achieve.
Right now, there's a bill called the MTM Pilot Bill that would essentially mimic what we're doing at the state level. It would allow Medicare and Medicaid, or certain people within Medicare and Medicaid, access to medically tailored meals like what Community Servings provides, and our colleagues across the Food as Medicine Coalition, but on a national level. And that bill is in the House right now. We hope with the upcoming election that it won't become a partisan issue and that it will be allowed to move forward, but we will see.
52 representatives in Congress have sponsored the bill so far, including 49 Democrats and 3 Republicans. But with Republicans taking control of the House in the midterms, future support for the bill is unclear.
Not just Community Servings, but as a country, as a nation, philanthropy dollars are only going to go so far. This medically tailored meals really needs to become part of healthcare, and that's what we're working towards. We envision a world in which everybody has access to food, the food that they need for health as a fundamental right, and that's really what we're working towards.